Elective course Ethics and Medical Jurisprudence, second BHMS, professional course CBDC. Module 4 Indian Medical Jurisprudence. This is lecture 3 now regarding documentation and medical records in homeopathy. Speaker is Dr. Ragini Raut, MD Home, HOD, Associate Professor, Department of Forensic Medicine and Toxicology, Bharati Vidyapith's Homeopathic Medical College, Pune. This lecture 3 has documentation and medical records in homeopathy. Importance of accurate medical documentation, legal requirements and standards of medical records, confidentiality and data protection laws, case studies on documentation issues. All these topics will be covered by this module under the documentation and medical records in homeopathy. Accurate medical documentation is required in homeopathy for continuity of care which ensures consistent treatment and follow up. In this, the first part is communicate treatment prognosis to the patient, which ensures good communication. Legal protection protects the practitioner in case of legal disputes or malpractice claims. Right documentation throughout the treatment with communication to the patient and their relatives. This will help the doctor for self defense if some situation may arrive in the future. Accurate medical documentation requires in research and analysis also. This facilitates research analysis, improvement of homeopathic treatments. Research improves the quality care and skill of doctor. This improves the patient safety also, which helps to identify potential allergies, interactions and adverse reactions. For this, write information after taking the history, which helps to know the various allergic conditions of the patient by asking them history, past history or his family members history, so that you can be, so the patient's safety can be ensured from our side. Accurate medical documentation is required for the homeopathy for the quality assurance, demonstrate adherence to the standards and guidelines. Patient's empowerment, which informs the patients about their treatment and health status. Present status and what is the present treatment the patient is taking, and what is the present health status and what is the requirement of the sufficient care to be taken by the physician has to be explained to the patient in detail. Communication. This enables clear communication among the healthcare professionals. Proper and pure communication is required. Communication is main breaching the doctor-patient relationship, and it will develop to have a proper rapport with the patient. Audit and evaluation. Whatever the facilitates evaluation of the practitioner performance and clinic quality. Teaching and training. It serves as a resource of teaching and training homeopathic practitioners. Training helps the doctors get updated on various recent disease, treatment, their prognosis, which helps to treat and patient in the new disease cases. Also, by training and teaching, we can update our diagnosis, our treatment protocol, and we can assure or we can guide the patient about the timeline about his treatment. So, it will help the patient and the doctor both the ways. Regulatory compliance meets requirements of regulatory bodies and laws. Accurate medical documentation in homeopathy ensures compliance with regulatory bodies and laws, meeting the essential requirements for legal standards, patient safety and quality assurance in the practice. So, this helps in forming the regulatory help in the regulatory bodies also and laws also, so that patient safety can be assured. Accurate medical documentation also helps the patient personal and medical history, and whatever the patient personal history and medical history data you are collecting absolute confidentiality and patient secrecy has to be maintained on the part of the doctor. Symptoms and diagnosis, whatever the symptoms you are accumulating, proper diagnosis should be assured. By taking the symptoms and by giving the diagnosis, you can plan the treatments accordingly, and by planning the treatment, your prescription should be accurate in the same way, which will help also to keep the follow-ups also properly, and by keeping the follow-ups, you can go for the progress of the notes, that is called as the prognosis, where we are, in which direction we are going, and that direction is really helpful and positive for the patient or not, that we can decide by keeping the follow-up with the patients. Then test results and investigation, as we have discussed, there are necessary investigations which help you for the proper diagnosis, and for the proper diagnosis which will help you for the treatment part. So, test results and investigations are required. If the patient is allergic to something or he is sensitive to certain drugs or medications or certain items, so we should, by taking the history, we can assure about the allergies and sensitivities of the patients. Then medication list, whatever the medication patient is taking, you should know he is going under which medication. Then correspondence and reference, whenever there is a requirement of taking the opinion, so you should be corresponding and you should refer the patient whenever it is near, if it is a case of emergency or casualty affair, so you should refer the patient to the biggest institutes. Informed consent and patient agreements, whenever you are dealing with the patients, critical cases, emergency cases, you should always take the informed consent and patient's agreement for the same. Practitioner notes and observations, whenever you are dealing, what is the prognosis, what are the investigations, what is the patient status of the patient, or if you are referring the patient to the other physician. So, practitioner's notes or opinion, or after seeing the patient, after examining the patients, what are your observations, your findings are required to write down, which will help you for the say in the future if something went wrong. By maintaining the accurate and detailed medical records, homeopathic practitioners can provide high quality care, reduce the risks and enhance their professional reputation. By doing all these things, we can give the quality care to the patients. By giving quality care, right diagnosis, we can reduce the risk and you can assure about the patient safety, and by doing that, you are maintaining your professional reputation in the society. Legal requirements for medical records in homeopathy. Indian Medical Council Act 1970